I'm Silvia Gabriela Scintee. I'm a public health and health services management specialist. I work as Deputy General Director for the National Institute of Health Services Management in Bucharest, Romania. I have almost 30 years experience in the field of public health and health services management, and I'm happy to be with you today.
Thank you. And what key lessons have we learned in managing and protecting at-risk populations that could strengthen future responses?
There is a great amount of literature on lessons learned from COVID-19 pandemics. First of all, we learned that our health systems, even in most developed countries, are not resilient enough for coping with the external shocks while sustaining required operation and quickly resuming optimal performance. Based on COVID-19 experience, the European Observatory on Health Systems and Policies developed a methodology for health systems resilience testing at different shocks, which countries can use to identify areas where improvements are needed. As well, the European Union established the Recovery and Resilience Facility, a 650 billion euros post-COVID program to support reforms and investments across different policy areas. Better managing and protecting at-risk populations would be possible, on one hand, by implementation of social protection policies that should address different dimensions of vulnerability, and on the other hand, improving health system resilience. Social protection policies are supposed to decrease social inequalities by alleviating poverty and to avoid social exclusion through provision of income support and service coverage against different risks, ensuring basic needs and promoting more inclusive societies. Improving health system resilience assumes, first of all, improving governance by increasing the ability to take immediate action, better collaboration among different sectors, building and maintaining communication channels among partners, but also with the population in order to build trust, combat misinformation, and improve health literacy. Another area of focus is provision of health services, for which necessary improvements include better preventive services and surveillance systems, to be able to stop the outbreak before it starts, to contain the spreading of the virus, especially through the current technology that can create computer models to predict how the virus would spread, and orienting targeted measures related to lockdown, travel restriction, and other measures, but also to decrease the size of at-risk population through vaccination and combating chronic diseases. As well, it is necessary to have a good testing capacity and available services for those getting the disease, and to ensure equitable access to let no one behind. Also, specific services are needed, such as telehealth or mental health support. Health systems should also have a mechanism in place for securing additional funding for dealing with external events such as epidemics, as well with other resource generations. Having sufficient numbers of trained public health staff is a critical need, as we saw during the pandemics. Human resources should be available for both dealing with the epidemics and also maintaining essential services, preventive and curative, especially for the most vulnerable populations, such as children, older persons, people living with chronic conditions, minorities, and people living with disabilities.
Okay, thank you. And what strategies remain most effective today to protect vulnerable groups, and where do you see gaps that still need to be addressed?
The most effective strategy is to combine measures that avoid getting the infection with vaccination that protects against severe illnesses or even death. People at risk should be educated about the preventive measures to reduce the chances of infection, such as avoiding crowded places, keeping distance from others, wearing a mask in the public, ventilating indoor spaces, washing hands with soap and water frequently, avoiding touching the eyes, nose, or mouth with unwashed hands. As well, those diagnosed with COVID-19 or who believe that they might be infected are advised to stay at home except for visiting a healthcare provider, in which case should call in advance, wear a face mask, cover cough and sneezes with a tissue, regularly wash hands with soap and water, and avoid sharing personal household items. The most effective and best way to protect vulnerable groups from severe illness, hospitalization, and death is vaccination. Vaccines significantly reduce risks of getting severely ill or dying from COVID-19 compared to being unvaccinated. As well, it is important to stay up to date with boosters, as by time the immunity wanes and the virus evolve. The boosters include updated formulas for newer variants and offer strong protection. Gaps in protecting the vulnerable groups are represented by social inequalities that make certain population groups unable to access information, unable to obey the recommended measures because they lack of clean water and sanitation, poor housing, and lack of other basic needs, unable to access health services, including vaccines. As well, special attention should be given to the populations in the armed conflict regions that cannot benefit of usual preventive and care services. On top of this, a serious problem to be addressed is misinformation and lack of trust, which makes difficult the implementation of any preventive measure.
Okay, thank you. And for the last question, as we look ahead, what should public health professionals and policymakers prioritize to better safeguard at-risk populations and the broader community in the coming years?
Based on the experience and lessons learned from COVID-19 pandemics, both public health professionals and policymakers should enhance their collaboration and coordinate their efforts towards preparing for the next public health crisis. They cannot work separately since they have complementary roles. On one hand, public health professionals, through their experience and expertise, um, bring evidence for policy-making process. And on the other hand, public health measures recommended by the specialists to better safeguard the population should be based and endorsed by health policies and legislation. So, strengthening pandemic preparedness is an urgent priority for both public health professionals and policymakers, and they should develop a preparedness plan, should promote intersectorial work and international cooperation. The pandemic preparedness plan should be easily adaptable to various scenarios for various pathogens and hazards, should be flexible and scalable according to different degrees of severity or duration of a crisis, should include all sectors' response with clear responsibilities and dedicated resources, should be tested and adapted regularly through simulation exercises, and should include internal and external communication strategies. Intersectoral work is very important as the preparedness plan should follow and foster a One Health approach due to deep connection between human, animal, and ecosystem health. Building collaborations across sectors is also required to find a mitigation strategy for the social factors that keep certain groups at higher risk, as many factors that pose the population and communities at risk are outside of health sector. Public health professionals and policymakers also need to collaborate for ensuring a better population protection, especially for vulnerable groups, by investing in public health infrastructure, ensuring equitable access to health services and support systems, improving communication, improving health literacy, and building public trust in health authorities, and combating misinformation. As well, building international collaborations is very important for sharing knowledge, resources, and insights, especially since the poor capacities of some countries in prevention and response to infectious diseases result in international spreading of the disease. As the COVID-19 pandemic revealed significant gaps and inequalities in the world's ability to prevent and respond to health emergency, a WHO pandemic agreement was adopted by the World Health Assembly on 20 May 2025, which will act as a legally binding international instrument designed to strengthen global collaboration in pandemic prevention, preparedness, and response. The agreement is dependent on the political will of countries to implement the principles of collaboration and mutualization it contains.
Thank you very much, Silvia. All of this was really insightful, and I hope that it gives a better understanding and clarity about the need for the COVID vaccination. So this is only episode 1 of other episodes that we're going to be having about the COVID-19 vaccination. So please make sure to like and subscribe to our channels so that you can watch the other podcasts that will be coming out later in this year. Thank you.